When Monica delivered our daughter, Medicaid covered everything. Government programs literally kept our family alive. So when people say they don't want to pay taxes, I get it. Because I feel like the rich buy our politicians up and they end up benefiting more from the policies they push than anyone who's considered middle class or lower. But I also know what those taxes did for me. They gave my family a chance to come out of poverty. They helped me and Monica finish school and helped us get through some of the hardest years without having to worry about how we would pay for it. I know firsthand how much government support can mean to someone who's struggling. Now, Trump's new tax bill, this one big beautiful bill, is being sold like it's some win for working people. If you work in healthcare, you really need to pay attention to this entire video. Because this bill isn't about tax rates. It's about what happens to our paychecks, our hospitals, our student loans, our patients, and whether programs like Medicaid will even exist a few years from now. On July 3rd, Congress passed Trump's massive new tax bill. It's a nearly 900-page piece of legislation that's packed with changes that mostly benefits the wealthy and big businesses. And some of these tax breaks do sound nice, don't get me wrong. Like making overtime tax-free up to $12,500. Or making tips deductible up to $25,000 a year. The bill also expands the standard deduction. For married couples filing jointly, it's now $31,500. So if you and your spouse earn a combined $200,000 a year, your taxable income drops to around $168,500. That saves you nearly $7,000 in federal taxes right off the top. And the SALT deduction, which is the state and local tax, is also getting a temporary boost. If you live in a high tax state like California or New York, this is where it's going to really matter. The cap goes from $10,000 to $40,000 for most people making under $500,000 a year. So instead of getting capped on what you can deduct, you'll likely get to write off the full amount you pay in state income and property taxes. But that's only good through 2029. In 2030, it goes right back down to $10,000. So on paper, that all sounds good. But this same bill also makes the 2017 tax cuts permanent. It slashes $543 billion in clean energy investment and makes massive changes to social programs. And this is what this video is primarily going to be about. It adds nearly $3 million to the national debt over the next decade. And the White House claims that it's going to spark new jobs and growth. But the Congressional Budget Office, a nonpartisan federal agency, predicts that there's barely going to be 1% in new growth. Meanwhile, the bill cuts $841 billion from Medicaid. That's the single biggest cut in the entire package. And it's not just numbers on this piece of paper. Nearly 11 to 12 million people are projected to lose coverage. Many because of work requirements and new red tape designed to quietly push people off the rolls. And here's the thing that I need to mention. A lot of people claim that people who support these government assistance programs are taking advantage of the system. And if you really think about it, the people who qualify for Medicaid are using Medicaid for medical necessities. If they go to the ER, they need Medicaid to pay for the visit. If they get admitted into the hospital, they need Medicaid to pay for that. If they need medications, Medicaid is going to pay for that. If they need to receive preventative care, Medicaid is going to pay for that. Let me give you an example because Monica went through something similar to this. When Monica was 17 years old, she gave birth to our daughter. She was a teenage mother at the time, and there was no way that she would have been able to go back to high school, finish her high school education, while also raising a newborn baby had she not been receiving Medicaid at the time. And if you're a mother looking to receive Medicaid with the new big beautiful bill that was passed, there is no way you would qualify unless you work 80 hours or more per month. And for nurses, this is a double-edged sword. Sure, you might get a boost in take-home pay, but if more of your patients lose Medicaid, they'll wait longer to get help and they'll show up sicker. And not only that, think about how much this is going to cost the hospital systems. Many hospitals are going to have to close because a lot of them rely on Medicaid reimbursements. You'll be the one dealing with it. Fewer nurses on the floor, more admissions, more preventable complications because these patients aren't going to be seeking care anymore since they don't have Medicaid. And they'll only end up in the emergency department as a last resort. They won't be able to see a primary care doctor anymore. A lot of these people are going to be the ones that are going to be the most affected by this. This bill also guts student loan relief. Under Biden's SAVE plan, a nurse making $80,000 might have paid $312 a month. But under this bill, that same nurse is going to owe $917 per month. That's a jump of almost $3,000 a year. And the $543 billion rollback in clean energy, that's not just a climate issue. It affects jobs, infrastructure, and public health long term, especially in the lower income communities that supported this bill hoping for relief. So yeah, you get a tax break, but it's paid for by slashing the very programs our patients depend on. And in some cases, the same programs that helped us survive. Let's say you're working in Northern California, earning $120 an hour and picking up extra shifts. You're making about $250,000 a year, plus $20,000 in overtime. You'll benefit the most from this bill. Let's run the numbers. Let's say you're making $120 an hour. That's $249,600 as your base salary. $20,000 in overtime is $269,000 in total. The first $12,500 of overtime is now tax-free, and it saves you about $4,375. And bracket changes are going to save you another $2,000. So your total take-home benefit is going to be around $6,300 to $6,500. But let's say you're a mid-income nurse and you're making $60 an hour. That's $124,800. If you work $20,000 in overtime, that's $144,800 in total. That saves you about $3,000 from overtime. And it saves you another $1,200 to $1,500 from the bracket changes. Your total take-home benefit as a middle-income nurse is $4,200 to $4,500. But now let's look at the lower-income nurse. Let's say you're making $35 an hour. That's $72,800. And $20,000 in overtime, that's $92,800. So this bill is going to save you $2,750 from overtime and an additional $800 to $1,000 from the tax bracket changes. Your total take-home benefit in this scenario is $3,500. And none of these nurses are getting taxed at 37%. That doesn't kick in unless you're making over $600,000. That's actually one of the reasons we're building this app called MapMyPay. We keep seeing nurses move across the country for what looked like a big paycheck and a big pay bump, but when you factor in housing, taxes, cost of living, it's like they're actually worse off. So we're building this app where you can compare cities side by side and see what your paycheck's actually worth after all of that. If anyone watching wants to try it out early, you can join the waitlist at mapmypay.com and I'll let you know as soon as it drops. Okay, back to the story. So the real savings are decent, but they're not life-changing. Let's be real, this bill was written for high earners. The New York Times ran the numbers, and the top 20% of households gets around $6,000 a year from this bill. The bottom 20% actually lose money, about $560 in benefits a year. And long term, this debt isn't sustainable. We're pushing our debt to GDP ratio to 130%, the highest in US history. You know what? That's likely going to raise the borrowing costs for hospitals and schools. It means hiring freezes, delayed raises, and thinner staffing. And nurses are definitely going to feel this. And if you're making good money, this is the time to protect it. This is not going to be permanent. It's just a tax break that is going to last in a couple of years. If you're newer to nursing and making $50 to $60 an hour, you'll still see a short-term win unless you're paying for your student loans. Then that short-term win is going to be offset by the amount that you're going to have to pay in additional student loan payments. You're going to get back an additional $4,000 to $5,000 extra in take-home pay next year if you don't owe in student loans. But don't spend it like it's guaranteed. This bill raises student loan payments, slashes tax credits for health insurance starting in 2030, and it's your patients that are going to feel that the most. They won't qualify anymore, and they won't know it until it's too late. If you're in a rural facility or a hospital that depends heavily on Medicaid, this bill could be devastating to you. The CBO, or the Congressional Budget Office, which is a nonpartisan agency, says that these cuts plus new work requirements could remove over 10 million people from Medicaid. Most of them won't even know they lost it until their coverage gets denied. And that's your patient base: pregnant women, cancer patients, kids with chronic illness. All of them are going to lose access to care. And when hospitals can't recover these costs, they're going to close. Or they'll cut hours, or they'll lay people off. If you're in that kind of setting, you need to get ready. Keep your license active in multiple states if you can. Keep your resume updated and stay certified in anything that lets you move fast, like wound care, hospice, or telehealth. On the surface, this bill looks like it's a win for hospitals. More write-offs, more deductions. But when the money dries up and Medicaid dollars disappear, hospitals will shift that pressure straight down to the floor where the nurses work. And Trump's new tariffs on top of it. Everything from IV tubing to generic meds is going to cost more. Hospitals will try to make up for it by reducing staff, stretching ratios, or just burning through nurses until they quit. And the care of your patients is going to be delayed, no doubt about it. They're going to avoid follow-ups, and you'll be the one trying to fix it, with less help, fewer supplies, and a longer hallway full of call lights. And make no mistake about it, this bill gives a short-term high to people making good money, but it does it by gutting everything that helped families like mine survive. If we didn't have food stamps, WIC, Medicaid, or Pell Grants, I don't know where we'd be. If Monica didn't have free childcare and maternity coverage as a teenage mom, it would have been more challenging than it already was. And now, those are programs that are quietly being cut. When you look at who wins and who loses here, you'll see that the richer you are, the more you benefit. And the people who actually need help are going to continue to struggle. And if you like this video, then check out my video on the impact that Trump's new tariffs will have on the nursing industry.